everyone, we're here at the Lake Almanor Clinic at Seneca Healthcare District. I'm here with Stefanie White, our newest primary care provider to the Lake Almanor Clinic. Hi Stefanie.
Hi Brandy.
Thanks for being here today.
Yeah, thanks for having me.
Of course.
Perfect.
So let's start off with a little bit about Stefanie. Stefanie, how long have you been in the medical field?
So I've been in the medical field for about over 15 years. I started my nursing career here actually as a medical assistant.
Wow.
I was originally hired as a receptionist and then quickly transitioned to a medical assistant. And then through multiple years of learning things here, I decided to go back to school and became an LVN and then progressed to RN and now nurse practitioner. I did most of my nursing career at Enloe Medical Center and then came up here and worked and noticed there was a huge gap in our need for primary care services. So I went back to school to become a family nurse practitioner, in which I do specialize in primary care services.
Beautiful.
Yes.
Well, thank you. We're glad to have you.
Thank you.
So we're here today to talk about primary care services and why they're important in the community. Can you tell us a little bit about primary care?
Sure. So primary care is one of the most important things we can do in medicine. It's really important. It gives us a grasp, especially for anyone that has any chronic medical conditions, that gives us a pulse point to be able to track you throughout your whole time you're here. One of the best ways we can do that is through annual exams. And your annual exams, which by the way, insurance covers them 100%, so it's a really good opportunity to come in and get that. But it's where we just kind of have a huge overview as far as like your overall health, how you're doing with your medications, where you are with your preventative measures. And so some of those preventative measures is the best time to order them is during your annual exam. And those would be like colonoscopy, bone density scan. It's a really good opportunity for us to get up to date on immunizations throughout all ages and stages of life. And then there's other various things we can do, and it just gives us a really good opportunity to catch all for, versus just coming in when you're sick, when you have a cold, cough, or flu or something like that.
Got it. Thank you for that overview.
Yeah.
So it sounds like having a baseline is very important for your overall care.
Yes, absolutely. And that is the best way to get it, is to come in for an annual exam. And baseline gives us a better opportunity to see where you are and how you progress in your disease process, or you don't progress. That's the goal, right? And prevention is one of the best ways to do that and to stay healthy. Knowing where you are in your healthcare and your healthcare spectrum is one of the best ways to stay and maintain a better healthy lifestyle. And it gives you an opportunity to develop a personal relationship with your provider. I feel like as a provider, when you have that opportunity to sit down and have those lengthy discussions, it helps you build a better communication, a better rapport, and you usually will have better health outcomes when you have a good relationship with your primary care provider.
Absolutely. Well, thank you. Good to know.
Yes.
All of that is very useful information.
Yeah, for sure.
So annual exams and having a baseline in the system is very important.
Yes. The other thing too that we can use for primary care services, not just for when you're sick and you have a cold or a cough or anything like that, is to help get ready for certain things in part of your life. Primary care services can also do surgical clearance. If you're having a surgery done by a specialist, they can come in and make sure you're healthy enough to have said surgery. Another thing we can use it for is sports physicals. Most kids, when they're getting ready to go back to school, usually around middle school to high school age, all are required to have a sports physical to be cleared to participate in sports activities. And a lot of times that is a really good way to come in and get established with a primary care provider, or even to just get a real quick checkup to make sure everything is okay to be able to participate in those sports.
Great.
Mm-hmm.
Great, thank you.
Yeah.
So how can somebody come into the Lake Almanor Clinic and establish with a primary care provider?
Everyone has their own process, but for me, I like to have I call it an established care appointment, and it's sort of just like a meet and greet, just to make sure we're both on the same page. It's a good vibe. It has to be a good fit, or you're not going to come back to the doctor. So I usually like to start it with a meet and greet. We sit down, see where you are, what chronic conditions you have, what medications you may be needing, and if there's anything acutely that you need. And then once you're established, the next step in that process is to be, if you're available and ready for it, we do an annual physical. And I always like to do my annual physicals with fasting labs as well. It's the best way to catch everything in a one big picture snapshot, and then insurance covers it as an annual physical. So that's kind of always very helpful.
Great. Well, thank you for being here with us, Stephanie.
Yeah, thank you, Brandy. This was great.
Of course. If you'd like to make an appointment at the Lake Almanor Clinic or establish with a primary care provider, you can call the Lake Almanor Clinic at 1-833-227-3743. You can also get on the website and make an appointment via email or request an appointment via a form. Thank you.